Have you ever noticed that a strong smell has the power to take you anywhere? How certain scents unlock memories and feelings. Like getting a whiff of vanilla can put you back in your grandmother's kitchen when you were 10, baking together. Scent is powerful, and we all realize it even if we're not fully aware of it. But what if we harnessed that power to feel good during pregnancy? Are you a little more skeptical of that? Do you feel like I'm trying to sell you essential oils? No worries, this isn't an MLM scam. This video will go deeper into the real science behind why aromatherapy works and how we can use it in pregnancy and during childbirth to unlock parts of your brain to help you feel happier, more calm, even fearless. Hi there, I'm Brittany, a mom, an experienced doula, speaker of real stories to help pregnant folks and their partners navigate the trimesters of pregnancy with ease. In my class every Friday, the Pregnancy Power Hour, we talk about using simple tools such as aromatherapy to reduce annoying symptoms of pregnancy like nausea and morning sickness, but also headaches and fatigue. I strongly believe that every pregnancy deserves both wisdom and wellness. So my approach to pregnancy education blends evidence-based guidance with holistic wellness, empowering expecting parents with practical tools, natural remedies, and movement practices that support peaceful, comfortable pregnancy. Head over to pregnancypowerhour.com or click the link in the description to grab your spot today. Aromatherapy is often brushed off as hokum, when in fact it's rooted in science. It's been used for centuries to naturally remedy many ailments like nausea, headaches, anxiety. Aromatherapy, which is a branch of herbal science, is just the collection of methods for skillful, controlled use of essential oils to promote physical, emotional, and psychological health. But how does it work exactly? Let's get a little geeky for a second. When we inhale a scent, the aroma travels from your olfactory nerves, your little smelling synapses, directly to your amygdala, the emotional processing center of the brain, and the hippocampus, the memory center of the brain. Inhaling scents sets off activity, including hormone release, within the parts of your brain that controls your emotions. And that's just one of the reasons why people may feel calmer and happier after aromatherapy. These smells influence our brain and our nervous system. Smells are directly connected to feelings and memories. It might also work by decreasing cortisol, the stress hormone, or by increasing serotonin, which is just the messenger between your nerve cells. So in other words, essential oils might work by increasing the output of your own body's natural stress-relieving substances. That's really an incredible process. And we can harness this process in pregnancy to create calm in childbirth by crafting anchor memories connected to certain smells. Whenever you're in a state of calm or bliss, smelling something like sweet orange or eucalyptus will anchor that feeling in your mind so that whenever you smell it again during labor, you will be put into that mental state of calm tied to that aroma. And to touch briefly on the evidence, there have been a number of studies reviewing the efficacy of essential oils and aromatherapy, but very few have made their way to clinical trials, meaning there is just unreliable, direct evidence to prove that aromatherapy is an effective treatment for certain ailments. Research has shown in these studies that aromatherapy is an applicable treatment for anxiety and reduction of stress, so much so that hospitals and ICU wards have adopted using aromatherapy to ease their patients' stress levels. So, despite having hard evidence that proves aromatherapy is a natural treatment option, nurses and doctors alike have recommended its use in the most stressful situations for their patients to help lower anxiety. There have been a couple of trials studying nausea using lemon scent, which is positive in these results, and we'll dive deeper into that in just a minute. But before you begin using aromatherapy, speak with your care provider to be sure that you don't have an underlying condition that may be aggravated by essential oil use, such as asthma or even allergies. Let's talk more about the different essential oils and their uses. I have personally benefited from using aromatherapy in my pregnancy and during childbirth. In my first trimester, I was extremely nauseated all day long, but it was massively improved by the use of aromatherapy with oils such as lemon, clove, eucalyptus, and peppermint. The citrus scents do have an impact on nausea, and this was the focus of a clinical trial in 2014 that actually involved pregnant people, surprisingly enough, and it had very powerful results showing a reduction in nausea and vomiting with the use of lemon essential oil. And I can personally vet this. In my pregnancy, I carried around a fresh lemon so that I could scratch and sniff the peel to feel less nauseated. It works. That sounds ridiculous to carry a whole lemon, so obviously you can opt for a more discreet inhalation method. There are essential oil carriers that you can put into a necklace or a keychain. You can diffuse the aroma into the air, which will turn any environment into a soothing space. You can also dilute the oil in carrier oil, such as coconut or jojoba, or into a lotion as well to rub into your skin, focusing on the less sensitive areas like your wrists, your chest, and your ankles. But what other scents are powerful for reducing pregnancy symptoms? Well, we now know that lemon and citrus oils delete nausea, but other grounding scents can have the same effect, such as clove, cedarwood, ginger, and peppermint. We go back to peppermint a lot. That is a very powerful aroma. These can also reduce heartburn and other gastrointestinal issues as well. As a doula, I was trained to use aromatherapy not just in pregnancy for comfort to reduce annoying symptoms, but in childbirth as well, to curate the environment, to suit the needs of each stage of labor. So in the early stages of labor, we want a relaxing space to rock and vibe and encourage restfulness. So we turn to lavender, jasmine, and rose. These are known to reduce anxiety. In the more active stage of labor, when you're working the hardest and feeling contractions regularly, we want to use invigorating scents, so like sweet orange and eucalyptus. In the transition phase, so just as you're about to meet your baby and you begin breathing baby out into the world, clary sage is known to cause uterine contractions. It's important to understand that clary sage should not be used in pregnancy until after 30 weeks gestation because of its effects on the uterus. It is potent and should only be used with the supervision of your care provider. We can use clary sage after baby is born as well to continue to stimulate contractions so the placenta is birthed with more ease and the uterus clamps closed to prevent hemorrhage. Using aromatherapy in pregnancy and during labor may be a great tool for you, and it's a simple one to incorporate. Essential oils are easy to come by, but you want to use a high quality oil that are pure and undiluted, and only buy essential oils that come in brown glass jars. This is the Whole Foods clove bud, and you'll notice it says 100% essential oil. I want you to try to experiment with the smells and oils that help you feel calm and happy, relaxed, or like laser focused so that you can turn to these when you need them. You will be more sensitive to smells in pregnancy, so it can just benefit you now to harness the power of aromatherapy to feel good in pregnancy and achieve your labor goals. Let's talk more about the powerful practical tools for a calm and confident pregnancy together in class, the Pregnancy Power Hour. Join us this Friday to hear more about pregnancy magic and simple tools that work. You'll find the link below. And in the comments, I want to hear from you if you try aromatherapy. What scents work best for you if you conquer any annoying pregnancy symptoms, and if you try them during your labor? Pregnancy comfort doesn't have to be complicated, and I hope that you can try this tool to feel good in your pregnancy.